You've definitely seen it. Hanging there by a hospital bed, that simple, clear IV bag, right? It's so common, we barely even give it a second thought. But what if I told you that inside that bag is one of the most powerful and precise tools in all of modern medicine? Yeah, let's take a closer look. It's for sure not just lauder. It's a super carefully crafted solution, and it's designed to do one thing: save lives. But how does it actually work? And how on earth do doctors pick the right fluid when everything's on the line? Well, that's exactly what we're about to break down. So, when you boil it all down, IV fluid therapy is all about one thing: balance. See, when our bodies lose fluids or electrolytes or blood, things get out of whack. These solutions are like a special forces team sent directly into the bloodstream to fix the problem right where it's happening. Okay, but here's the first big secret. Not all IV fluids are the same. Not even close. They basically fall into two major families, and the difference between them is absolutely fundamental. So let's meet the crystalloids and the colloids. It really all comes down to just one thing: the size of the molecules inside. So think of it like this. Crystalloids, they're like salt dissolved in water. The particles are tiny, so they can easily seep out of your blood vessels and into your tissues. But colloids? Oh, they're more like sand in water. The particles are way bigger, so they're pretty much stuck inside your veins. They can't escape. And that one little difference in size, it creates a massive trade-off for doctors. Crystalloids are the affordable workhorses of the hospital. They're cheap, they're everywhere, but you need a lot of them, and that can cause swelling. Colloids, on the other hand, are the heavy hitters. They work super fast with less fluid, but they're expensive and come with some serious risks, which is why a lot of the time they're the backup plan. All right, so since crystalloids are the first line of defense in most emergencies, let's dive a little deeper into that family. These are the fluids you're most likely to see, and they have this fascinating secret weapon. And that secret is a word called tonicity. Now, it sounds all technical, I know, but it's actually a really simple idea. It's just how concentrated the fluid is compared to our own blood cells. And this one little property, it controls everything the fluid does once it's inside our body. You know, the best way to get your head around tonicity is just to think of the Goldilocks principle. Seriously. Isotonic fluids are just right. They match our blood's concentration perfectly. Hypotonic fluids are too weak, and hypertonic fluids are too strong. And as you're about to see, each one has a very, very specific job. First up, the just right solution: isotonic fluids. Because their concentration is a perfect match for our blood, they don't cause any big fluid shifts. They just hang out in the blood vessels and boost the volume. This makes them absolutely perfect for treating shock from blood loss, trauma, or really bad dehydration. But what if the problem isn't the volume in your blood vessels, but that your actual cells are thirsty? That's when a hypotonic or weaker solution gets called in. Its job is to push water out of the bloodstream and into the body's dehydrated cells. Now, the big risk here, and it is a major one, is if that fluid rushes into brain cells, it can cause life-threatening swelling. And on the complete flip side, you've got hypertonic, or stronger fluids. They do the exact opposite. Their super high concentration literally pulls excess fluid out of swollen tissues and back into the bloodstream. It's an incredibly powerful way to treat brain swelling, but it can also overload your whole circulatory system and, you guessed it, flood the lungs. So that's kind of the everyday toolkit for most situations. But what happens when doctors need something even more powerful, something more specialized? Well, that's when they call in the second family, the colloids. Colloids are often called plasma expanders. Remember those big molecules? They are experts at holding fluid exactly where it needs to be, inside the blood vessels. This makes them crazy effective for specific cases, like using albumin for severe burns or Dextran for critical trauma. But like we said, this power comes with some serious risks attached, like allergic reactions, kidney damage, or even bleeding problems. Okay, we've met the two fluid families and all their members. Now we get to the most important part. How does a doctor choose the right fluid for the right crisis when every single second counts? It's a massive, high-stakes decision that really depends on one thing: understanding exactly what has gone wrong in the body. Is it a blood volume problem? Is it a cell hydration problem? Or is it a tissue swelling problem? The diagnosis dictates the fluid. It's as simple and as complicated as that. And this table here just illustrates that decision-making process perfectly. So for instance, a patient comes in shock from losing blood. What do they need? They need to have their blood vessels refilled fast. So you grab an isotonic fluid like normal saline. But someone else with dangerously low sodium, oh, they need a potent hypertonic saline to pull water out of their swollen brain cells. And for severe burns, you might need a colloid like albumin. You see, every condition has its own precise prescription. Choosing the right fluid, that's only half the battle. Administering it safely is just as critical, because even the right solution can cause a lot of harm if it's not managed perfectly. You know, IV therapy is not without its dangers. You've got local problems right at the IV site, like a leak or the vein getting inflamed, but the systemic or body-wide risks are even bigger. Too much fluid can totally overload the heart and lungs, and even tiny errors can throw the body's entire electrolyte balance into complete chaos. And this, right here, is why patient safety rests so heavily on the shoulders of nurses. Their role is so meticulous. Before they even start, they are triple-checking everything: the order, the bag, the date. Then, during the infusion, they're like a guardian, constantly watching the drip rate, the IV site, the patient's vitals, everything. And afterward, they make sure it's all completed safely. They really are the final and most important line of defense. So the next time you see that clear bag of fluid, you'll know. You'll know it's so much more than just saline. It's a specific targeted prescription. It might be a cell hydrator, a plasma expander, or a delicate balancer. It's a powerful reminder that sometimes the simplest looking things in medicine are actually the most complex and the most life-saving.